In many theories of emotions, they'll have groupings of feelings. They'll have an angry group of feelings, which will have emotions like anger, resentment, rebellion, or they'll have a scare or anxiety group of feelings. They will have things like fear, scare, fright, nervousness, and there are two other groups of feelings that are sometimes mistaken for each other. Despair is often mistaken for depression. Depression is a group of feelings. It's down, sad, melancholic, so it has a down type of feeling to it. It can also include a big internal critic, and there's a lot of negative self-talk as well. So that's a sort of grouping in what we would call a sad or depressive group. Then there is another one called the despair feelings, and this group is not so much down as the person will report a thing like there's a vacuum inside, there's a hole there, or it's things like there's nothing inside, there's a bit missing. So we don't have the sense of down and sad. It's just a vacuum, there's a nothingness. So often people were reporting this despair type, and they will be misdiagnosed as depressive. That obviously is not a good thing, because they're misdiagnosed and thus will be given the wrong treatment. For instance, they'll be prescribed antidepressants when they're not depressed. This group of feelings called the despair feelings is usually not a good sign. It is indicative of a person who has some maladjustment. A person of some maladjustment. So often it results from significant emotional abandonment in childhood, where the child has gone beyond anger, gone beyond fear, and then ends up in a despairing type of state, where they've almost sort of given up trying to cope and coerce parents into establishing attachment. There is another type of despair that results from this, what's called the pull to non-life. That is, some infants are born when they have there's not a zest for life, they lie there. So what needs to happen is they need to be given considerable affection, strokes, whatever you want to call it, where the child is pulled out of this natural tendency to go into non-life. Interestingly enough, that person is not suicidal. It's not that they don't want to die. It's not that they want to die. It's just that they don't want to live. There's this pull to non-life.